Welcome back, SuperDoc community, to another episode of the SuperDoc Insights. Today, we are diving into a topic that plays a massive role in healthcare and beyond: innovation. Innovation isn't just about fancy new technologies or breakthroughs, it's about problem solving, simplifying processes, and making things easier and better for those around us. In this episode, I'll take you through the story of Dr. Sven Ivan Seldinger, the man behind a simple technique that transformed healthcare. We'll also reflect on some of my own experiences from the ICU, moments where I had to innovate on the spot. I'll share a case where an out of the box decision was the difference between life and death. Are you ready? Let's get started. Let me start with an inspiring story of Dr. Sven Ivan Seldinger. Back in the 1950s, Seldinger was trying to solve a problem that many doctors faced: performing catheterizations in a way that was safer and easier. He developed that what we now call the Seldinger technique, a method that involved inserting a needle into an artery or vein, threading a guidewire through, and then using it to place a catheter. This simple idea revolutionized procedures like central lines, pigtail insertions, and percutaneous tracheostomies. Today, the Seldinger technique is an integral part of modern medicine, used worldwide in hospitals every day. What fascinates me most about this story is that Seldinger didn't set out to make history. He simply wanted to make a process easier and safer for both doctors and the patient. This is what innovation is all about: finding ways to simplify the complex and solve the problems that matter. Now, let me take you to an ICU case that truly tested my problem solving abilities. We had a patient with advanced thyroid cancer who presented with severe stridor. During the night, the patient accidentally extubated himself. The swelling in the neck was immense, making it impossible to reintubate him through conventional means. As the patient was rapidly deteriorating, I found myself in a position where there was no obvious solution. No textbook would guide me through this. It was then that I remembered the percutaneous tracheostomy, the set we had lying around, but the swelling had blocked off most of the accessible areas in his neck. I had to feel my way through the anatomy, palpating the neck to find a small space just around the cricothyroid membrane. With no time to lose, I inserted the needle, followed by a guidewire. Just like in Seldinger technique, dilated the area and placed a small sized ET tube. The patient stabilized, we got him through the night. That moment wasn't about textbook knowledge. It was about solving a problem in real time. Innovation came from the sheer necessity to save a life, and having that mindset allowed me to act fast. Innovations, as we have seen, can come in critical moments, but it's not always easy to embrace. There are mental blocks that often hold us back. I have often felt that self doubt and the fear of failure kept me from thinking outside the box in the past. Sometimes there's that hesitation: what if it fails? What if I'm judged? These thoughts can be paralyzing, especially when we are trying to innovate. In a field as serious as healthcare, especially. But what I have realized is that intention and purpose are key to breaking through these blocks. In the case of thyroid cancer patient, my intention was crystal clear: save his life at every cost. That focus allowed me to push aside the fear and try something new. I've spoken before about Master Bharat, a 14-year-old GBS case who came to our ICU. His condition was dire: respiratory failure, ventilator associated pneumonia, and at one point CO2 levels that were dangerously high. In that case, our team had to get creative to keep him alive. We played with negative suction for ICD, tried multiple approaches, and somehow, bit by bit, he began to recover. Today, I see his case as a reminder that when intention is clear, the innovation follows. The purpose behind your actions is what drives you to think beyond the boundaries of traditional methods. So, how do you foster innovation in your own life? It's about deliberate observation, problem solving, and setting a clear intention. In my personal journey, the key to unlocking innovation came from letting go of fear and embracing problems as an opportunity to grow. But it wasn't just about making decisions in the heat of the moment. My experiences have taught me that innovation also requires a deep sense of collaboration. For those of you listening today, whether you're a student, a healthcare professional, or someone looking to make an impact in your field, ask yourself these questions. What problems do you see around that need solving? Where can you simplify a process? How can you innovate in a way that adds value to others, not just yourself? Are you holding back from trying something new because of self doubt? Innovation isn't about reinventing the wheel, it's about simplifying, problem solving, and focusing on a clear intention. Like the Seldinger technique, sometimes a small idea or a solution can have a ripple effect that transforms healthcare or even your own life years down the lane. So look around you. Where can you innovate today? Thank you for joining me today. As always, stay balanced, stay innovative, and stay in the zone. Until next time, take care.